Hey, I'm here with Nick Cruse from the Revolutionary Blackout Network, and guess what? So they did the most definitive study ever on masks, and community masking doesn't work. So there it is. It's from Cochrane Library. Physical interventions to interrupt or reduce the spread of respiratory viruses, and it doesn't work. And what does that tell you is that when Dr. Fauci said this at the beginning of the pandemic, he was telling the truth.
Right now in the United States, people should not be walking around with masks.
You're sure of it? Because people are listening really closely to this.
Right now, people should not be walking. There's no reason to be walking around with a mask. When you're in the middle of an outbreak, wearing a mask might make people feel a little bit better, and it might even block a droplet, but it's not providing the perfect protection that people think that it is. And often there are unintended consequences. People keep fiddling with the mask and they keep touching their face.
And can you get some schmutz sort of staying inside there?
Of course. But when you...
Wow. So he was telling the truth then, as Dr. Vinay Prasad tells us. He says, many may not know the science never changed. Fauci told the truth the first time on 60 Minutes. He lied the second time about cloth masks. Because Trump didn't do it, academics had to. So they were just doing the exact, whatever Trump said, they did the opposite. So Trump said he didn't like masks, everybody had to wear masks. Because Trump didn't do it, academics had to and couldn't read the literature. Because, by the way, all the literature was already there before. It was always negative, as Cochrane confirmed. So the literature was always there. And so this Cochrane, they took all the biggest studies and they, however the scientists, smarty pants people do it, they put it all together and they figured there's no studies that show masks that have little to no effect on the spread, community spread of viruses like this. Here's the big summary findings. With 76,000 participants in random controlled trials or cluster random controlled trials, masking does nothing. No reduction in influenza-like or COVID-like illnesses, and no reduction in confirmed flu or COVID. That's stone cold negative. See those effect sizes and confidence intervals. I don't know what that means, but if you're a scientist, you probably do. And then here's the thing, and it shows you right here. I'll show you in a second, but this shows you it doesn't do anything. So this is the relative effect, 0.84 to 1.09, basically nothing. So this is why Fauci said what he said initially on 60 Minutes. He wasn't lying. The best evidence showed no benefit. That was before we saw a concerted campaign to promote cloth masking, a bizarre way to treat anxiety. People routinely wore cloth masks outside, something that was less 21st century and more third century, akin to animal sacrifice and dancing to make the rain come. That's what wearing a mask outside is. He's comparing it to doing a rain dance. That's how much science is behind wearing a mask outside. We never had good data that mask mandates help, or that mask advice, a softer policy, improves outcomes. Yet it was widely pushed, most likely to distract from true federal failures. After vaccination, not only do we not have evidence, but it is irrational to mask. At best, you marginally delay the inevitable, and unlike pre-vax, there's no milestone you're waiting for. This is what I was saying since I had Dr. Robert Malone on my show in the summer of 2021, and when I started to see that that they were lying, and that mandating stuff like this was wrong, and that there's actually deleterious effects. So when you wear a mask, the main way you pass that virus to yourself is through your fingers. And so you're always fidgeting with your mask. There's unintended consequences. And so when you touch your mask, you're actually putting the bacteria and the virus and shit on your mask that you're now breathing in, because all that stuff is on your fingertips and then you're putting it on your mask. And that's the unintended. So that's why. So in a laboratory, in a perfect setting with a perfect fitting, that's one thing. But in the community, the way people actually wear masks, well, here it is, and it can be worse for you. It can be worse for you because you're touching your mask all the time and you're getting virus and bacteria, or as Dr. Fauci said on that video, schmutz. And there's unintended consequences. And that there are studies that show that masks have a negative effect and increase bad things. There are studies out there, credible, and there's a theory about it that has a name. I forget what the name is. It the Folsom theory? I'll think of it. Hang on. But here's also one more thing that is devastating. Wearing a medical/surgical mask probably makes little or no difference compared to not wearing a mask for this outcome. So this is according to Dr. Vinay Prasad. Let me be clear. The science did not change. Public health experts started lying. So when I brought on Dr. Jay Bhattacharya, who authored the Great Barrington Declaration, which had the right approach to dealing with the COVID pandemic, and he was smeared by Dr. Fauci and tried to be discredited. When he came on our show, he told us that Fauci was telling the truth about masks the first time, and then ever since then, he was lying. So I knew that when he came on our show. And Dr. Vinay says, who should we be angry with? Obviously, there is a class of Twitter experts that doesn't understand how to read evidence. Some of them have been promoted to be deans for public health schools. So much for public health. But the real failure is the NIAID and the CDC. It is Tony Fauci. Obviously, unlike the types of studies that the CDC likes, hairdresser anecdotes, which is what they were basing their mask mandates on, randomized trials are the best way to separate an intervention from the habits of someone who embraces them. So what are they? Randomized trials. Fauci controlled the NIAID budget. He could have run 10 random controlled trials of masking, different masks, different ages, different settings. He chose to run 0. Why is that, you think? Is it because he already knew what the outcomes of those trials would have been? And that's why he ran 0 when he should have? Instead, he went on TV 1,000 times and lied about the effectiveness of cloth masks. The first time on 60 Minutes, he told the truth, and the rest were lies. And now, as this doctor says, Dr. McCune, he says, in any sane world, this would be the end of mask discussion. As a community intervention, there is no evidence to suggest they work. I have to break it to you. We don't live in a sane world. We live in a world run by a handful of billionaires that own the media and every legislator, and then they push a narrative, and that's the crazy upside down pretend world of science we live in. That's the world we actually live in. We don't live in an objective reality. We don't live in an objective science. We live in whatever the billionaire who owns the media machine wants us to think. That's why you thought ivermectin was a crazy horse medicine instead of a WHO list of essential medicines that has saved billions of lives and is super cheap, pennies. That's why you thought that, because the billionaires who wanted you to take the vaccine didn't want you to think ivermectin was a human medicine. That's why. Because on the chance it could treat COVID, they had to totally lie to you to make you think you were mental if you wanted to take that. There are tremendous amounts of people who call others anti-vaxxers, despite the fact that they still wear masks after receiving 4 or 5 vaccination doses. Apparently, they don't actually think their 5 doses will protect them, but a facial decoration will. Do you get what he's saying? He's saying there are people with taking 5 vaccines still wearing masks. Do you not believe in the vaccine? Because I'm vaccinated against polio, measles, all that stuff. I don't worry about catching it anymore. That's why I don't wear a mask, to shield myself. When I get in an elevator, I don't worry if the other guy's been vaccinated for polio. I want to show one more thing, and then we'll bring in our guest, Nick. I want to show, this is from March of 2020. So this is before they all started lying about masks. This is CNN saying the same thing Fauci was saying. You ready?
Over coronavirus climbs in America. Top U.S. health officials have a stern word of caution. Preparedness is appropriate. Panic is not.
There are things that actually can harm you and your community, and going out and hoarding masks is one of those things.
Since the outbreak began, millions of people around the world have donned surgical masks, hoping to fend off the virus. Chinese President Xi Jinping was seen wearing one in public. But top health officials and experts say masks often don't provide adequate protection against something like coronavirus.
But that's CNN in March of 2020 saying, even though you see people wearing masks, the experts say they don't provide protection from something like the coronavirus, which is similar to a flu virus. Similar, not the same.
So the typical mistake is what? I put this on and it may or may not fit. And what am I doing wrong here?
So right now you're wearing a mask that's supposed to be fit tested, that's supposed to be fully sealed. At this point, it's not. So you'll see that you can actually, there's space where your nose is, that particles could actually potentially get underneath the mask.
Public health experts say many people who wear masks don't have them properly fitted. That means constant adjustments. And
so this is the difference between testing a mask in a laboratory and testing a mask in real world, in community masking. They're not perfectly fit. People don't wear them right. They're constantly moving and touching their masks, which makes it worse because all the dirt and bacteria and virusy stuff is on your fingers, and then you put it on your mask. It stays there, and then you breathe it in. And by the way, even the CDC says if a mask gets a little wet, you got to get rid of it immediately. But of course, people don't. They keep breathing through them all day long, and they get wet with their breath, and they just leave them on all day. So watch what they say here. They say exactly what Fauci also said, that you can get stuff on your fingers and then you touch your mask and an unintended consequence. And they're going to say the same thing. Let's listen.
If you don't have them properly fitted, that means constant adjustments and more risk.
You're not used to wearing it. You don't know what to do. You might be touching your face more often. All of those are opportunities to actually get yourself sick.
Yeah, because the way you get yourself sick is touching you. Bob, this is how you get yourself sick. You got it on your fingers, you touch your face. So you're going to be touching your face and mask way more if you're wearing a mask. So it's probably going to increase your likelihood. I'm not saying definite.
It's because our hands are our biggest transmitters of the virus.
Our hands are the biggest transmit. This is what they were saying in March 20th of 2020, March of 2020. They were saying exactly what Fauci was saying because that's what the science always said. And then they flipped it. And everybody now has to theorize why. Everybody has to speculate as to why they started lying. I wonder why. But you see, even CNN was saying the truth in March 2020.
Get yourself sick.
That's because our hands are our biggest transmitters of the virus. The more you touch your face, the greater your odds of getting sick. Major retailers say there's been a run on masks at stores, and if they're cleared off the shelves, there's a dangerous potential ripple effect.
If we actually utilize masks inappropriately in the community and in the general public, they won't be available for healthcare workers who actually need them to respond.
Public health experts say there are myths about masks. One is that one single mask can be used indefinitely.
These are supposed to be single-use masks, but some people might wear them for days, in which case you might get the bacteria might grow inside the mask.
So what should average healthy people be buying? Soap and household cleaning supplies, experts say, and make sure you stock up on whatever medications you're already on. As far as the best habits to fend off coronavirus, health officials say there are some very simple but important steps.
Wash your hands as frequently as you can. If you cough in your elbow and not on your hands. And try to stay away from crowded places where there are a lot of people who are coughing and sneezing.
What if you have to travel on a plane or another tight, crowded space? Should you wear a surgical mask then? Experts say that's a judgment call, but you have to make sure it fits you perfectly. That you know how to use it, and just use it one time. Brian Todd, CNN, Washington.
Now, I don't think you should wear the same mask if you're on a 5-hour flight for 5 hours. You should probably change that mask a couple times. Anyway, let me bring in Nick Cruse from the Revolutionary Blackout Network. So now the definitive studies have been done. There has never been any science that says community masking stops the spread of those types of viruses. That's now the science. It was always the science. They then flipped it for no reason, but for a reason I don't know why. But here is Nick.
Yeah, COVID-19 has been such an incredible case study on how our ruling class can lie, propagandize, and attack anyone who is telling the truth about this stuff, aka anyone who reports on the study. The same people who claim they are pro-science, they look at these studies and they don't give it no mind. I don't know if you've seen these people. There are people on Twitter to this day that tweet stuff like, raise your hand if you proudly wear a mask every single day. There are people on Twitter. Yeah, you see it. Their identity is I wear a mask, and they attack people who don't wear a mask, despite these studies showing that masks do not work. I'm a very scientifically minded person, Jimmy. Like I want to see what works and what does not work. I remember when this pandemic first started, just like you and just like all of us, we was all scared, and I had the mask on at first, and then I saw people wear masks get sick around me. I'm like, okay, this seems like it's not working. Then you had the first original studies that come out that show that mask doesn't work, so I ditched the mask because I'm a very scientifically minded person. But I think you call them COVIDians, like these people who love the COVID culture war. You can't tell them nothing. You can show them the mass study. There are people to this day, and people I know in real life, that still believe that vaccines stop the spread of the virus. And I explain this stuff to people. I show studies that don't do it, and they still refuse to accept it. So these people that start out
these COVIDians, Nick, they'll be critical and demonize anybody except Big Pharma, the FDA, the CDC, Fauci, but anybody else, any other doctor who has a different opinion, they demonize them as if they're all grifters, as if the biggest grift wasn't Big Pharma. Somehow Big Pharma money is pure, which has infected every part of our culture, but somebody else, another doctor's funding is suspect. That's the things that these they are mental cases.
And they're trust of the government that lied to us many times before. The reason why I love your coverage and the reason why I'm open to questioning COVID narrative, because I remember how the FDA lied to people about diet when they used to tell people that carbs is good for you and fats is bad for you. And this is something as a martial artist I learned, like they completely lied about us about that. They lied to people about cigarettes in the 70s.
That's right.
So if our government and science is wanting to lie for that for money, why wouldn't they do it today? So that's been my mindset when I saw that Big Pharma making $1,000 per second on the vaccine. And when I see you show these people shifting their narrative, obviously something is up. But there are a lot of these COVIDians who they don't care about science. They worship the altar of Big Pharma. And I can't really tell you why, Jimmy. I think they maybe had this pathology where they literally believe that Big Pharma is the reason why people are living longer. So maybe they like have this reverence towards authority in the medical community because they see us making advancements. It makes no sense, but we have so many evidence of the government just blatantly lying for profit. And there's no one they are more willing to lie to than Big Pharma, one of the biggest funders of the ruling class.
So now I want to show you what they say about N95 masks. It says 4 studies were in healthcare workers, and 1 small study was in the community. Compared with wearing medical or surgical masks, wearing N95 respirators probably makes little to no difference in how many people have confirmed flu, and may make little to no difference in how many people catch a flu-like illness. Unwanted effects were not well reported. Discomfort was mentioned. So that's also, she didn't come back to me. So that was also in the study. So that was also said in the study. I find that very interesting. And let's just remember, if you don't think Fauci is a pathological liar, you can put Nick back. That he is I'll show you right now.
That the NIH has not ever and does not now fund gain of function research in the Wuhan Institute.
Do they fund?
So you heard him, right? They do not fund it. Gain of function research in the Wuhan. The NIH does not. He said that to Congress, which if that's a lie, that's a felony. Turns out it's a lie. But of course, he's never going to be prosecuted because Fauci was lying at the behest of the people who own those politicians. So one of those politicians who gets his money from Big Pharma is not going to go launch an investigation criminally against Fauci. That's why he can lie to Congress, which is what he did. The NIH, major shift, it admits they did fund that. And let's remember how he tried to scare people who criticized him. Let's remember.
There, so it's easy to criticize, but they're really criticizing science because I represent science. That's dangerous. To me, that
you can't, if you criticize him, you're criticizing science, even when he's lying. Isn't that crazy? That's crazy. That's what a megalomaniac says.
Yep.
And that's what he is. Why do you think he was allowed to keep that job for, 45 years or whatever it was? It's because he's doing the bidding of the friggin' guys who own the government, the big pharma people. That's why he was kept that job through 15 administrations. That's why Trump wasn't allowed to fire him. Because people more powerful than him, the people really pulling the strings in this country, the billionaire class with all the money, they wanted him there. People forget he was the bad guy in that movie, The Dallas Buyers Club, with Matthew McConaughey. Why did they have to have a Dallas Buyers Club? Because he wouldn't let them use safe medicines to treat AIDS. He would only allow them to use the medicines that would make Big Pharma a lot of money that didn't work. That's why he was the bad guy in the Dallas Buyers Club. And why isn't there no one on TV reminding people of that? Where's Matthew McConaughey to remind people of that? Where's the director of that movie, the writer of that screenplay? Where are they?
Yep.
And what did the study actually recommend? This study that just debunked all this, what did they actually recommend? Well, they said there is a need for large, well-designed, random controlled trials addressing the effectiveness of many of these interventions in multiple settings and populations, as well as the impact of adherence on effectiveness, especially in the most at risk. And so now who does that sound like? That's Dr. Vinay Prasad saying, who does that sound like? It sounds like him, Dr. Vinay Prasad, because since COVID started, he's been screaming about where are the random controlled trials. He's been saying, where are they? Fauci should be conducting them, and they refuse to. And now this paper, the definitive study on masks, now says they should be doing this, and they're still not doing it. Why do you think they're not doing it? So, and of course, I have to tell you that the CDC still recommends masking in areas with high rates of transmission, along with indoor masking in areas with medium rates of transmission. So that's all the stuff I said to you now isn't true because the CDC says that. So I'm just telling you that stuff as information because I can't go against the CDC on YouTube. That would be misinforming you. And I don't want to misinform you. So I'll tell you what the big pharma funded CDC makes YouTube say, because that's what's real. And if I told you the opposite, I would be misinforming you. This is YouTube telling you I have to tell you this, or else I would be misinforming you. Wow. Nick, do you have anything else you'd like to say about this?
This is a great report, and this is why you got to always question what government officials say. And this is what made the government, what they do, especially around COVID, so nefarious, because I know people in my real life, and I'm sure you guys do as well, they're not really that political. They just trust what they see the medical guy on TV says.
That's right.
They see a guy named Dr. Fauci. They see him say one thing. They don't know all the receipts like you and me may know. And they just follow his advice, even though he gives people bad advice. And they're just the normies that follow whatever the government says. That's why shows like these, this is why I do a Revolutionary Blackout. We need to debunk what the ruling class is saying. That's so right. People can have a better way to live their life. And they have a monopoly on information, and through independent media like Jimmy Dore show and my own, that we can continue to inform and call out these people. That's why I have an unbelievable amount of disgust. The people who make the careers, the COVIDians, the people who spend their time defending people like Dr. Fauci and the big pharma that spread lies to people that harm their lives. So keep up the great work on this stuff, Jimmy. And this is why everything the government says, I assume is lying until proven otherwise.
That's exactly right.
That's why I do. And for the most part, and I know you do this as well, Jimmy, it works out well for us.
Yes.
Now, there's a study. I don't know if you saw this study. I got to be careful because I want to make sure I quote the numbers right. So I'll be vague. There was a study I saw recently that showed that the amount of American adults that are vaccine hesitant is at an all-time high.
So I saw the number at 35% now. And that's because of all the misinformation that has been communicated to them about around COVID, not just the vaccines, but about COVID also. So now they don't trust anybody anymore. And now they're not getting their little kids vaccinated anymore like they're used to prior to COVID. It actually had the opposite effect. It made people more vaccine hesitant. Congratulations. It wasn't people like Jimmy Dore. It wasn't people like Nick Cruse. It was people like everybody at MSNBC, CNN, the New York Times, the Washington Post, the Intercept, wherever, every other corporate news outlet. Those were the people who are actually making people vaccine hesitant. Fauci is the people making people vaccine hesitant. Big Pharma, the FDA, the liars at the CDC, and they are liars. And the liars at the NIH, and they are liars. And Fauci at the NIAID is the biggest pathological liar I've ever seen in government. And that's a bigger liar than Trump.
Yeah. And that study is actually good news because it shows that these lies have consequences. And when people are exposed to a lie, it like a domino effect where they start questioning other things. I don't know if you know this as well, but the COVIDians, the people who push Russiagate, the people who advocated voting for Joe Biden, is one circle. It's the same people because these are the people who have not gone over that leap that the establishment lies to you. If we can expose that establishment lies to it via COVID on any random thing, that make it less likely that they would believe in something like Russiagate. It'll make it less likely for them to believe that Joe Biden said what he's going to do on the campaign trail. So I think these things have a domino effect, and that's why I think it's extremely important to call this stuff out. So it's good to see what you're doing. It's good to see that the lie about the masking is being exposed.
And the vaccine, by the way, I want to tell you one more thing about the vaccine. So when they would say people are dying who are unvaccinated versus vaccinated. So if you got your vaccine and then you got COVID the next day and died the next day, they would call you unvaccinated. If you got your COVID vaccine and then you got COVID 2 weeks later and then died 3 weeks later, they would call you unvaccinated.
No way.
So you weren't fully vaccinated unless you had both shots and it was 4 weeks after your second shot. Then you were fully vaccinated. So that's how they also skewed the numbers. They've been lying to us. And it's such an enormous level. It's like our brains can't even comprehend the lying that they've been doing. They never even tested to see if the vaccine stopped the transmission of the virus. And then they mandated it for people and you couldn't work or you couldn't travel or you couldn't go to a restaurant. You couldn't do anything based on nothing. And I knew that was not the case. I knew that the countries that had the highest vaccination rates also had the highest rates of COVID. And I was pointing that out on my show starting in 2021. And people immediately started calling me anti-vax, saying whatever I was saying was just for money. As if the money isn't in fucking going along with Pfizer. That's where the money is. Why do you think you guys think all the wrong shit? Anyway, but I do have to tell you that the vaccine is safe and effective, and it will slow the transmission and contraction of the virus, and it'll keep you from getting seriously ill, hospitalized, or dead. And I have to tell you that because YouTube tells me to tell you that, because if I don't tell you that, I'm misinforming you. And I don't want to misinform you. And so that's why I tell you what YouTube tells me to tell you, and I'm pretty sure they got it straight from Bill Gates' asshole. Hey, we're doing live stand-up comedy in Los Angeles, Tempe, Arizona, Palm Springs, Milwaukee, Minneapolis, Nashville, Northampton, Massachusetts, and a lot more places. Go to jimmydore.com for a link for tickets and become a premium member while you're there. You get access to all of our stuff. See you then.